Hi ma'am, my name is Vanessa Mendoza from BSN1C and I am going to perform the breast assessment. Purpose is, first, the goal of the breast examination is to determine if the breasts are normal or abnormal. 2. Breast self-examination is invaluable for detecting cancer in its very early stages to check whether or not you have any signs of particular disease or illnesses. So the equipment required: the examination table, the patient hospital gown, the record form, the disposable gloves, and the small pillow, and the slide for specimen ruler. So now let's proceed to the preparatory phase. First is to greet the woman respectfully with kindness in order the woman to be comfortable with you throughout the physical examination. 2 is to tell the woman that her breasts are going to be examined. Explain to her the procedure in order for her to cooperate. Next, ask the woman to change patient hospital gown, and after that, tell your patient to undress from her waist up. Have her sit on the examining table with her arms on the at her sides to get the easier access in performing the breast examination. 4. History taking. Ask the hormone replace therapy family history of breast cancer to assess the history bloodline of the family if the certain disease is present among them. Then 5 is to wash hands. To prevent the spreading of infection and bacteria such as viruses. That's it. Good morning, ma'am. I am Vanessa Mendoza, your student nurse for the name. May I know your name, ma'am? How old are you, ma'am?
19.
Ma'am, may I ask you if you have any health history like breast cancer? How about your family, ma'am? Okay, ma'am. So today, ma'am, we're going to have an assessment of your breast. Will that be okay?
Yes po.
Okay, ma'am. Thank you. So next is to wash hands. To prevent the spreading of infectious and bacteria such as viruses. So now let's proceed to the performance phase. Breast and axilla. General appearance. Note symmetry of size and shape. Assess for the size and shape if there are abnormalities present. Then, I have observed po, ma'am, that your breast asymmetry or a slight asymmetry in size often that the left breast is slightly larger than the right. Number 2, it's the skin. Inspect color, textile, bulging, dumpling, or any skin lesions of edema. The skin is normally smooth and even color. I have observed po, ma'am, that the skin of your breast is clear and it's visible normally during pregnancy. Pale linear or stretch marks often follow pregnancy and no edema present. 3 is the nipple. So, inspect symmetry, shape, any dry scaling, any fissures or ulceration, and bleeding or other discharge. So, the nipples should be symmetrically placed on the same plane on the two breasts. So next, so I have observed po, ma'am, that your nipples are protrude, which is usually normal naman po. So 4 is the maneuver to screen. So direct the woman to change position while you check the breast for skin interaction sign. First is to ask her to lift the arm slowly over the head. Then next, ask her to push her hands into her hips and to push her two palms together. Ask the woman with large pendulous breasts to lean forwards while you support her forearms. Both breasts should move up symmetrically. So, ma'am, can you straight your hand? Okay. Ma'am, can you put your hands here? Can you do this, ma'am? This. And ano na po, ma'am? Okay. So, I have observed, ma'am, that your breast is moved up symmetrically. A slight lifting of both breasts occur, and both of your breasts show the symmetric free forward movement, which is good to hear po. So, inspect and palpate the axillae. So, first is to ask woman to have a sitting position. Number 2, inspect the skin, noting any rash or infection. Then 3, lift the woman's arm and support it yourself. So, use your right hand to palpate and the left axilla. Reach your fingers high into axilla, then move them firmly down in 4 directions, down to the chest wall and align from the middle of the axilla along the interior border of the axilla, along the posterior border, and along the inner aspect of the upper arm. Inspect for infection and palpate for any masses or nodule of the breast. So, I have observed po, ma'am, that your breast is nudes and there are no presence of nodules, lesions, and edema po. So, next, palpate the breast. Help her to a supine position, then tuck a small pad or towel under the side to be palpated and raise her arm over her head. Number 3, use the pads of your 3 fingers and make a gentle rotary motion on the breast. Then start at the nipple and palpate in concentric circle pattern of palpation increasing out of the periphery. Move in a clockwise direction, taking care of to examine every square inch of the breast. Then, if you feel a lump or mass, note this characteristic location, shape, consistency, movable, distinctness, nipples. Is it displaced or retracted? So, skin over the lump, tenderness, lymphadenopathy. So, ma'am, can you please lie down? So, I have observed po, ma'am, that your breast is smooth and firm elasticity in young, and there is no presence of lesions and edema po. So, palpate nipples. First, palpate around the areola. Gently press Gently press nipple between thumb and index finger. If any discharge appears, note its color and consistency. So I have observed po, ma'am, that your nipples are light pink in color and its color is totally normal. To have some hair growing around your nipples po, which is also normal. So the male breast palpation. So number 1, inspect the chest wall, noting the skin surface and any lumps or swelling. Then 2, palpate the nipple area for any lumps or tissues enlargement. I have observed po, ma'am, that your breast has flat disc and undeveloped breast tissues, which is normal naman po. So we have now the other. So after completing this examination, had woman cover herself, explain any abnormal findings that needs to be done. If the examination is normal, told the woman everything is normal with the examination. After the examination, the patient has the right to know her findings about the assessment. So after the assessing breast examination, the overall findings are all normal. I didn't see any problems such as discharges, lumps, masses, or any other signs of inflammation, ma'am. So next is to wash hands. So to avoid getting the infection during direct contact examination with the patient. So next is document findings. So to be assessed by the attending physician. So ma'am, can you please sit down na po? So I observed that your breast during the assessment are normal naman po. And I don't see any abnormalities during the assessment. And for the final result, I will send you to your attending physician in order to know if there are abnormalities in your breast area po, ma'am. Thank you, ma'am. Thank you so much for your cooperation and